Welcome to the Veterinary Cancer Pioneers Podcast, the show where we delve into groundbreaking work of veterinary professionals who are dedicated to advancing the field of veterinary oncology. I'm your host, Dr. Rachel Venable, and I'm thrilled to embark on this journey with you. Welcome to the Veterinary Cancer Pioneers Podcast. I'm your host, Dr. Rachel Venable, and today I am so excited to introduce our guest, Dr. Andi Flory. If you've been listening to conferences or webinars, you've probably heard her name in the last year or so. She's been great about talking about the new company that she co-founded, as well as the Chief Medical Officer at PetDx. And they also have OncoCanine, which we'll hit about today, but I also wanted to talk more about where Dr. Andi Flory started. So she's been in oncology for almost 2 decades. She went to vet school at Ohio State and then did more training in Florida and Cornell, and she is a boarded oncologist. And she was in charge of residency programs. And I remember we talked once at a conference and you told me you never thought you would leave clinical practice. So I definitely want to hear a little bit about that transition that you've gone through. The other thing I think that's really interesting, you have a certificate in genomics from Johns Hopkins University. So certainly still learning, which is also really interesting. And also you have precision oncology and genetic testing and sequencing technology from Harvard. So very impressive schools. And you certainly are quite the lecturer. As I said, I feel like a lot of people probably heard your name now over the last couple of years. So I'm so excited to get to learn more about you and just hear some more of the backstory. So thank you so much, Dr. Flory, for being on this podcast.
Thank you, Rachel. It's so great to be here. Thanks for having me.
Oh, definitely our pleasure. So, as I mentioned, you've been in clinical practice for a long time and you trained residents and worked with interns. And so how has that process been? Or I guess, what was that final thing that made you switch now that you're more into research and industry?
Yeah, so I think it kind of started with a love of animals, of course, that was instilled in me in a very early age by an animal-loving mom. And then, just kind of from the very get-go, there were animals in my life that kind of helped me make decisions at different time points. And I think a lot of us in the veterinary space have those stories, right? Like there's a specific event or there's a specific animal that kind of made our path go one way or the other. When I was about 6 years old, I got a kitten. And when I held her for the first time and I felt her little heart beating, it was like this aha moment, like, oh my gosh, cats have hearts? Like, tell me more. Like, I want to know all about this science. And it kind of created this fascination for me. And so looking back, it kind of felt like this meant to be sort of happenstance of already loving animals, but like being exposed to kind of the medicine and the science and having that desire to know more. And then when I was a third year vet student going into clinics, our family dog got really sick and he was hypercalcemic and very, very ill. And he was ultimately sent to Ohio State where I was a vet student. And the workup led to a diagnosis of lymphoma, and he was a very young dog. So this was completely heartbreaking, right? To be like in love with this young puppy, and then now all of a sudden he has lymphoma. But, when my family and I met with the oncologist, which was Dr. Jerome Cotto, and the oncology resident, which was Carrie Kasarek, just the care that they provided and the hope that they gave us, it was like, oh, that's what I want to do. And then when I kind of rotated through oncology and I got to learn again about all the science, it was this aha moment of, oh my gosh, tell me more. Like, I want to know everything that I can do. And looking back again, it felt like London, who was my dog, was kind of put in my life for that reason, to kind of show me like, this is a path and this is your path. And so, fast forward through many years of clinical practice. And you're right, I didn't think that I would, I thought that clinical practice was kind of how my life was going to go. But I met another little dog that really changed the path of my career, which was my little patient named Poppy. And her, as it turned out, her owner is an MD, and he has a background in genomics and in liquid biopsy. So, as we went through her treatment, he let me know that he had helped to develop the technology that developed liquid biopsy for people. And, this was a time in my life where I was already kind of really investigating whether there was a different way, because I was seeing so many patients in clinical practice. I'm sure you see the same, where it's like, you just find them at a point where it's so late in the clinical course that there's not a lot of options that we can provide. And I was just like, I wish there was something else. I kept seeing these cases where it was like, I wish that I had found this case sooner, that we could have intervened and kind of offered something earlier. And so this happened right at this time, this kind of perfect time point in my career. And he said to me, do you think that veterinarians could use a blood test for cancer? And it was like, this is the answer. And so we really bonded over this kind of shared desire. He, we weren't able to kind of provide that for Poppy. We lost her in like 7 weeks. But he said, I really would love to be able to help other families that are going through this by detecting cancer earlier. And we just kind of bonded over that shared desire to find cancer earlier.
Well, I love that story because it is such a good story, right? Starting when you were a little kid, picking up a kitten. How many of us, growing up doing that? And then your experience with cancer in animals, even when you were a vet student and going through clinics, and then how another dog, like you said, changed your life, right? And thinking about the cancer blood test. Because I feel like throughout my career, I couldn't even tell you how many times owners have said, well, the blood work was normal. There was no cancer in the blood. And we're like, well, that doesn't really tell us much of anything, And so, but now it actually can. There really is a cancer blood test. So I really kind of enjoy that paradigm shift, at least, from talking with owners, like, okay, now they're not crazy. There really is a test that we can do. And now, so how did you go about? Because there had to be so many steps to go from being in clinics. As in your bio, you had to go to, John Hopkins, Harvard. I can't imagine the leaps that you had to do to go from clinics to co-founding a company, learning more about genomics. We learn about it a bit, but not enough, for like what you had to know. So what kind of big steps did you have to go through?
So, when we initially co-founded the company, I really kind of got a very rapid lesson in learning what being part of the startup world is like, which is like, hang on to your hat. This is going to go super fast. It's pretty much like a roller coaster. And, it went from idea to company in like days to weeks. And then it went from company to clinical trials in just a few months. And so it meant that like it's the pace is fast and furious. And I was still working full time as a clinical oncologist in 2 hospitals. I was overseeing internship programs at both of them, and I had 2 preschoolers. So it was a really, really busy time in my life. But I was so passionate about this. And we encountered a really good problem, which I think hits on what you just said, which is that as we were starting to recruit our clinical study sites, it really started with reaching out to friends and then, additional contacts too. But the good problem was that everyone said yes, because I think they had all heard that question, isn't there a blood test for cancer, for their entire careers. And so they're like, we want to be part of helping to answer that question. And I think also dog owners really love the idea of paying it forward for future dogs with cancer. So dog owners really wanted to help with this study too. And so it meant that, we ended up doing the study at 41 sites on 4 continents. We had over 1,700 dogs ultimately enroll in the program, which is those are mind-boggling numbers coming from the world of veterinary oncology, where we're used to studies that are like, 100 would be a big study. Or like, yeah, we do like, here's a case series of 5 dogs, or like, here's something that we base practice on and it's in 15 dogs. So these are, it was just kind of so overwhelming, but so exciting that that first step of it was just like, oh my gosh, I'm so like pinching myself that I get to do this and work with these amazing people and get to work on something as important as that.
Yeah, you mentioned clinical trials, because you're right. Yours is quite impressive. That's one thing I've always loved. Not only do you guys publish, but you publish with real numbers, right? I mean, as you mentioned in veterinary, we have a tendency to make a lot of decisions on a very small number. I mean, for pulmonary carcinoma, I think forever we were using vinorelbine from 4 dogs. That was the one study for years. Now there's slightly more information, but still not great. And you guys, the Candid study was 1,100 dogs, right? Somewhere. So yeah, that's just huge and amazing. How did you guys manage that? I mean, because I feel like there's a reason a lot of our vet studies are so small, and some of it comes down to just the structure, personnel, finances, that kind of thing. So how are you guys able to coordinate something to that magnitude?
I mean, I think that it just started with the priority of knowing that this test that we were developing is a multi-cancer test, right? And so we're not talking about one disease at a time. We're talking about all cancer. And so when you think about that and you put that into perspective, it means that you really have to have a lot of tests done to be able to capture a pretty good number of all of the different types of cancer. And so we knew that we had to make it big, and we knew that we had to have a very large control population of the cancer-free dogs. And so we knew that we had to have decent numbers of both, and really help to develop the algorithm and develop the test using a very large set of dogs as well. So meaning we knew that we wanted to have an independent training and testing set, which is really important in diagnostic test evaluation, that you make sure that your test is going to perform in the real world the same way that it does in your clinical validation study, where the status of the dog is known at the time of testing. You want to make sure that it's going to perform the same way in the real world for veterinarians that are using it in dogs where they're trying to figure out if they have cancer. So we knew that those things were really important. So we knew that, sample size was really, really important to us. And I have the benefit of working with people that are coming from the human medicine side, where large studies are the norm. So to them, it was like, well, of course, we're going to do a really big study, and so for me, convincing veterinarians with large sets of data was important. For them, it was kind of the norm to show the power of this technology. And it meant that, it was just a really exciting kind of project to be able to work on together. And we prioritized that we knew that we needed to have a really big sample size.
We were talking about clinical trials and all of the, dogs that you guys have been able to enroll. Can you kind of discuss in a little bit more detail? What did that trial look like? What exactly, how did you guys do that?
Yeah, so we started enrolling sites in late 2019, and then patients started enrolling that same kind of time frame. And we started the study at multiple clinical practice settings. So these were patients that were enrolled at general practices, as well as academic sites and specialty private practice clinics as well. So there were 41 sites. They were on 4 continents, actually, and dogs were enrolled into one of 3 protocols. They either were presumably cancer-free, meaning that these were dogs that were being enrolled at their general practitioner. They had no history or current suspicion of cancer based on thorough history or physical exam, or they were enrolled into one of the 2 cancer studies where they were either having surgery as part of their treatment or medical therapy as part of their treatment. And what's important to know about all 3 of these sets of dogs is that this was very much a real-world population of dogs, because dogs of any age over the age of 1 were allowed to enroll, and dogs with any type of cancer were allowed to enroll, and dogs with any comorbidities were allowed to enroll. So these were real-world populations of dogs that had acute and chronic medical conditions. They were allowed to have common skin and subcutaneous benign tumors like lipoma, sebaceous adenoma, skin tags, things like that. So we wanted to make sure that this was a real-world kind of population that any general practitioner or specialist would typically see, which is, we tend to see dogs that have lots of diseases by the time they're older. So when they're at risk for cancer, they generally have a risk for other kind of concomitant conditions as well. And so in the cancer patients, all of the patients were staged, meaning they had a workup to find out where cancer was in their body. And what we found at the end of that, when we looked at the performance of the test, is that we found that in the all-comers group, which was over 40 types of cancer, the detection rate or sensitivity of the liquid biopsy test oncocanine was 55%. But in the most common cancers that we see in dogs, it was 62%. So 62% in the most likely cancers that you commonly manage in practice. But for what I like to call the big three, which are lymphoma, hemangiosarcoma, and osteosarcoma, the detection rate was 85%. And all of this at a very, very low false positive rate of only 1.5%, meaning a specificity of 98.5%, which means, this is a really good test to look for a wide variety of cancers. And it's got a really low false positive rate. So it's also a very good test as a screening test in asymptomatic but high risk dogs.
That it's really interesting. You said that this was, you tried to make it as real world as possible. Cause again, a lot of times it's older dogs that get cancer, but they also have a lot of other issues. So did you find that those other issues affected the test results at all?
So no, I mean, with a test, specificity as high as 98.5%, it's pretty clear that false positives are uncommon and those comorbidities don't affect this. I mean, really the only thing that's going to cause a change in your DNA and those genomic alterations is really cancer. So conditions like inflammation, infection, autoimmune disease, things like that, they don't cause a false positive on this test.
Well, that's really interesting. Especially I can think of multiple times as an intern working on emergency. I don't do emergency so much anymore, but there would be so many cases where pets would be really sick and we were trying to decide cancer or infection or, what autoimmune, all those different things. So that is really interesting that you would know if you do this test, that if you got a positive, it, strong likelihood of cancer. And I know you guys also talk about doing more testing to confirm, but that is nice. I guess as a vet, I feel like it's kind of that extra reassurance that a false positive, well, possible, nothing's 100%, right? But it's pretty low on that list.
Exactly. Yeah, that's really important to have in a test like this.
One of the things that we've talked about at conferences and things, and that I do admire with PetDx is you guys keep publishing. I think we're starting to get more papers in the veterinary world from some of the startups, but I know a lot of them still can struggle, or even resident projects, just in our profession in general, but you guys definitely do a good job. What do you recommend for people that maybe either are wanting to do something else with their career or even academia and things like, how do you kind of just all sit around and brainstorm different ideas? How would you recommend keep publishing on the data and, looking and showing people what you have?
I mean, I think that it's a really interesting question. I think that the only way that veterinary medicine is going to continue to get better is making sure that we have great science, right? And that we back it up with great data. And so it really starts with making sure that the data is collected responsibly and that you're collecting the kind of data that you need, and that you report on what is important, I think, to veterinarians, but also for us, it was really important to kind of show that this isn't just a test where we were going to publish this one large clinical validation. We also really wanted to show them how it's working in the real world. So for example, earlier this year, we published in JAVMA an analysis of 1,500 consecutive samples that were sent to our lab early last year, where we then obtained outcome to find out not only how veterinarians are using the test and kind of what use cases they use it in, but also what happens after testing, what kind of results do they get and what happens when they work those patients up. And it just was so gratifying to see that the performance of the test really mirrored what we set forth in the clinical validation study, and that veterinarians, when they do have a positive, they're able to get to a cancer diagnosis easily using tests available in their own clinic in a short period of time. The median was 11 days. So these aren't, cancer hunts that take forever, or it's something that's hard to find. It's generally, very straightforward to then go ahead and find cancer and confirm cancer in those patients.
So how would you recommend that vets use oncocanine, or even when to use it?
So yeah, I think just kind of starting with a summary of what this really is. Oncocanine is a liquid biopsy test. So it's a blood-based test. It's in a category of tests called an MCED test, or multi-cancer early detection. This is a category of tests that is used in people, and it detects 30 different types of cancer with a simple blood draw. It uses next generation sequencing to evaluate a biomarker called cell-free DNA. So cell-free DNA are essentially fragments or short bits of DNA that are free floating in the bloodstream, which are released by cells. And this is normal cells and cancer cells when they die. So cells are constantly turning over. And when they die, they release their DNA into the bloodstream. And in the blood, that DNA gets broken down into pieces or fragments. And those fragments that are circulating outside of any cell are called cell-free DNA. And the subset that comes from cancer cells is called circulating tumor DNA or ctDNA. And so what we're able to do with next generation sequencing is evaluate those fragments and look for the genomic alterations that are, you can think of those like spelling mistakes, that are the underlying cause of cancer and that are present in the blood of a patient with malignant tumor cells in the body. And so if that's detected with next generation sequencing and bioinformatics, which is the computer science that looks for the presence of those genomic alterations, then that's called a cancer signal. So the result here is like, it's a yes, no, it's a binary answer. It's a cancer signal detected or cancer signal not detected. And then additionally, in a subset of cases, we also can determine the specific type of cancer that's likely to be present, and that's called the cancer signal origin prediction. That means that not only do you get that yes, no answer, so you get a yes answer, but you also get a CSO prediction. And right now that's available for hematologic malignancy like lymphoma or leukemia. It's that specific signal is present in about half of cases, but additional cancer types will follow. So that's really exciting. And, you know, this is a field that's always evolving and always changing. And so it's exciting to kind of see what new developments are constantly happening.
It is so amazing to me to just think about, you know, your DNA in the blood, that we can actually read that. Like, not to sound too nerdy, but it reminds me of like Star Trek, right? Like it's so exciting to see sort of just where science is going, right? And as you said, like they're having this technology on the human side. And so it's just really neat to see where all this is heading. And it also just sounds really confusing. Like you just said it very simply, but I know there's a lot of science and it's actually quite complicated, right? I can only imagine trying to read DNA in the blood. That sounds quite complicated.
It is complicated, but I think that, you know, we can boil it down to a few uses of where veterinarians can use it, and we kind of break those down into pre-diagnosis and post-diagnosis. So like pre-diagnosis is for dogs that don't yet have a cancer diagnosis, where it can be used as a screening test in an asymptomatic dog, but a dog that's maybe at higher risk because of age or breed. And then it also can be used as an aid in diagnosis. So this would be a patient in which you suspect cancer, or maybe because of their clinical presentation, something you can see on imaging, or something you see on lab work. And so those are the pre-diagnosis use cases. Then it also can be used on the post-diagnosis side. This is, I think, what oncologists get the most excited about. This is like for a patient that has cancer, where it can be used to monitor some aspect of their cancer therapy. So, for example, it can be used to detect residual disease remaining in the body after excisional surgery. And it also can be used to monitor for evidence of cancer recurrence after therapy.
Now, to use it for monitoring in that kind of scenario, it's still just blood tests, right? Are there serial blood tests, or how do you recommend, especially oncologists, using the OncoK9 for monitoring?
So for cancer monitoring, it actually starts kind of before the tumor is removed or before the treatment is started, because it really, you're going to get the most use out of it if you know that there is a signal present at baseline before treatment, because then it means that test interpretation is a lot easier. The results will mean more if you know that this is a cancer that is detectable by this test. So it can be really helpful to have that conversation with the client kind of ahead of time before treatment, to know that this is an option, that there's a cancer monitoring blood test, and that we should submit a sample prior to surgery. And I think that the cases where it certainly makes the most sense to do this are anything that's you think is going to have a high chance of either recurrence or metastasis internally, that's going to be more difficult for you to monitor easily. This could be an additional kind of layer on top of like helping you interpret the imaging to look for metastasis or to look for recurrence. We also, you and I just got back from the Veterinary Cancer Society meeting, and we had a panel discussion of oncologists, 3 oncologists that are using this across the country in different practices, but in their clinical patients. And one thing that they all said is that for patients that have insurance is generally covering this test for any patient that has a diagnosis or suspicion of cancer. So when you're using this either for monitoring or if you're using this as an aid in diagnosis, it seems to be covered. So that can kind of give you a little bit of a clue of like, well, which clients do you kind of prioritize talking about this with, but also kind of those, those owners that are asking for like, what's the best we can do? What are the most kind of tests we can do, or the best kind of tools that we have to manage cancer?
Yeah, that is really interesting because sometimes, as we know, especially ultrasound, it's not as sensitive as we would like. There's all kinds of studies showing that, it really doesn't pick up mast cell as well as we think, or hemangiosarcoma, where we might think it is. And then when they do histo, it's not. And so that is really neat, especially those cases with those organs. It makes me think of a case that I actually am working on with a friend. Of course, her little dog has got quite the complicated case, but it's something where, it had a neck mass, which actually came back as hemangiosarcoma. So anyone that's not an oncologist, nodal hemangiosarcoma is very rare, not something we know much about. And the spleen in her dog is also a bit abnormal, and it's changed over time, but on cytology, they're not seeing anything. And of course, also her little dog is done horrible under anesthesia and has had all kinds of complications. So, just removing the spleen isn't that simple. So that's something where I think, I think this could really be a good use for her, because I know she's really scared of surgery, because just the last surgery her little dog had, she's just had a lot of complications afterwards. So this might be, it's making me think, it's getting the wheels turning.
Yeah, I think those aid in diagnosis situations are, sometimes you're just like, what other tools do I have in my toolbox to help answer this question of, is this a case where conservative management is okay? Or is this a case where I need to convince the family that this is more urgent and we need to proceed with treatment? And sometimes that's kind of what that conversation comes down to. And it can mean that the getting to the diagnosis actually takes a long time, especially if they want to go kind of stepwise and they're a little hesitant, or they're not sure, or like in this case where the patient is maybe just not a candidate and they want to get to the answer, but they are not sure if they want to proceed. Those aid in diagnosis situations are some of the, I think, most intriguing, where I really see it helping so many veterinarians and families, because it's really helping to cut short that path to diagnosis, like getting to the answer faster, getting to the kind of being able for the veterinarian to kind of counsel more confidently and more directly about what is taking place. For aid in diagnosis, the settings where I'm seeing veterinarians are getting the most use out of this are when they, like you mentioned, when they're presenting with changes on imaging, like an aggressive bone lesion or a mass in the spleen or changes in the lungs, or we're seeing something on lab work like cytopenias or hypercalcemia, or it's like an inconclusive cytology, like you've tried cytology but you're just not getting kind of to the answer, or even clinical presentation like chronic weight loss or lethargy, a unilateral forelimb or hind limb lameness. That's kind of a confusing case. These are the cases where it's like another tool in the toolbox that can be another layer on top of imaging to help you interpret what's going on.
Yeah, no, I think that's right. Just that next tool, because, in the little doggy I was mentioning, the spleen keeps changing on ultrasound. So we're worried, but we still just don't know. So yeah, and it is nice to have some non-invasive tools, right? I feel like so often our tools are quite invasive. And so it's nice to have that non-invasive option. And then just to switch gears a little bit, I do want to know kind of, going as an oncologist, and most of us, the clinical oncology, we know sort of what that looks like, the day-to-day. But now, co-founder, chief medical officer, what does that look like for you? How would you describe that role and kind of how things are different, certainly compared to clinics?
Yeah, I mean, as chief medical officer, I kind of oversee all of the clinical and medical affairs parts of the organization. So I oversee our clinical studies team. So we're the team that writes the studies, gets studies approved, finds the study sites, works with the study sites to enroll patients, manages all of the data, reports out the results, all of that sort of thing. And then the clinical support team. So these are board certified specialists that reach out to veterinarians and when they receive a positive result and help walk through next steps, but they're also available for case consultation as well. So that has been hugely popular with veterinarians that have a specialist available to help walk them through their case. And then kind of on the other side is like medical affairs and the science side of things. So this is like, writing papers, developing education, giving webinars or planning out our webinars, doing studies with partners, developing studies, doing the data crunching, writing the manuscripts, all of that sort of part of the organization too. So I get to do a lot of very, very exciting things in all of these different areas.
Right. It sounds like you're wearing lots of different hats.
Yes.
And I'm sure managing lots of people. What would you say is the most challenging thing with all of that?
I think that it's just that there's not enough of me. Like if I could clone myself, then it probably would be a good thing, because I really like what I do. And so it means that it's very exciting to get to do all of the things, like go to all of the meetings and share our science and, come up with new ideas. But all of those projects take a long time, right? And they take a lot of hours. And so if I could clone myself, that would be really, really good.
Nice. I love it. Especially as a mom, you mentioned you had preschoolers. I feel like there's just never enough time, at least
Never enough.
personally, that's how I feel. There's just never enough time.
Exactly.
Now, since you've been in both clinical practice and now industry, what do you have any advice for veterinarians if they're thinking about making that switch over to industry?
Yeah, absolutely. I think that I kind of fell into industry in sort of a non-traditional way, I think probably, but I think that there are some tips I would say. I think for me, transitioning into industry was kind of a little bit tough in the beginning because I kind of felt like in my mind, I trained my whole life to do this one thing. And then I was considering not doing that one thing my whole life. And it was a hard decision. And so for me, I knew that I had to ask for help. And so that's kind of one tip I would say, that if you need help, ask for it. For me, it came in the manner of a career coach to help me kind of, I think as veterinarians, we're like really data driven. So I needed to just kind of like understand what are all the data points and the pros and the cons. But my career coach really helped me to understand like what's the best and worst thing that could happen if you do this or don't do this, and kind of pursue your passion and leave clinical practice, and the understanding that you can help more animals and more families and more veterinarians by doing something like this. And at the end of the day, you're always a veterinarian, you're always an oncologist, and there are no shortage of jobs you can go back to if it doesn't work out for some reason. So I think that's first, is ask for help. But I think also if you are considering industry, you kind of have to think about the parts of your job that you really love, the things that you're passionate about, and that give you joy, and try to pursue that. Like really try to see if there's anything that aligns with what parts of your job that you're really excited about. Because if you don't love genomics and you end up in a genomics company, that's going to be hard. And if you don't love flea preventives and you end up in a company where you're selling flea preventives, that's going to be hard, right? So it needs to be something that you're excited about. You mentioned before that I did certificates, and I think that's another tip, is consider getting more education. For me, I did those certificates in genomics and sequencing, one, because I was excited to learn, but also to help me feel as confident as possible around the topic. And I think anyone that's considering a move to industry might consider additional learning in whatever field you're considering. And I think that one of the additional things is get really comfortable speaking, because a big part of industry is educating and being a speaker. And I personally love speaking. I love everything about it. I love writing talks. I love shaping the storyline of a talk. I love figuring out how to educate. And I think taking courses or reading up on how to give presentations can be really helpful. And that's part of what I love about industry is that it's always leveling up. Like every talk that I give is a little bit better than the last one. And people always say to me, like, oh, I bet you've given this talk 500 times. You could do this in your sleep. And that's actually not true. Anytime I give a talk, it's almost the first time I've given it because it's always different than the last time. And I love that we constantly have that chance to make it better and tweak the message and tweak the, anything from like just how the message lands and how veterinarians perceive it and understand it. I really love that concept. So I think that those are kind of some tips of things that you could consider. And if there's any trainees out there listening, one of the most important things I think is that you do need clinical experience first to be as big of an asset as you can be in industry. Like having those 3 or 5 years of clinical practice means that not only are you an expert in your field and in veterinary medicine, but you're also an expert in how clinics work. And that's hugely valuable in industry. So I would say definitely if you are interested in industry, go out and get your clinical chops first and then ask around about jobs. A lot of industry jobs seem to come down to contacts. So it's a lot of it is who you know, but reach out to anybody that you know in industry to find out what's available and what's happening.
Yeah, so many good points. I like the career coach. I think a lot of times we don't really think about that in veterinary medicine. So that's great. And to keep learning, it sounds like that's really what's driven you through the whole process, getting more education, learning more, because you mentioned about presentations, clearly the science and the technology. But I liked what you said about presentations, because I think sometimes people forget that there's a whole market on that. And there really are skills, to learn how to be better at presenting and I'm sure writing, talking with people, all of those things. So that is really cool. Are there any presenting books or anything like that you recommend to people? Do you have a special or a podcast or something you like on that topic?
No, but there's like tons of free resources like TED Talks and all kinds of stuff where you can learn. Like there are people that do this for their whole careers, right? Is just to teach people of how to make presentations better. So there's lots of again coaches out there that you can get that can really help you understand how to really connect with the audience. And there's so many little tips and tricks about making sure that you're prepared and making sure that everything from your message to the way you practice to your eye contact in a talk. There's so many little factors that go into the audience getting your message and remembering what they're going to take away. And those things are really important. So in industry, being a good speaker is a huge part of that.
Right. Yeah. And I love all those tips because I do think I like to speak as well. And I agree with you. I think there are just lots of little things you can do that make a big impact. We all remember sometimes maybe the teacher, or if we've gone to conferences where they just looked down and never looked up and just read the whole slide. You don't want to be that person if you can at all, all avoid that. And before we get things really wrapped up, I am curious, what are some new technologies coming out? I always like to ask everybody this, new technologies. Obviously, I know we talked about oncocanine, but is there anything else in the veterinary field or maybe the human field that you're kind of excited about that has been, gradually coming together?
I think on the liquid biopsy side and what I do, I think that the most exciting part of this is just the big data part of it. Like we mentioned before, like we're used to these very small studies, and like we just published a study in over 4,800 dogs. That is enormous for what we do. And, something like that, when you deal with a data set that's really large, it means that you can find, for example, things that occur very infrequently. That particular paper that I'm mentioning was looking at potential evidence of something called clonal hematopoiesis of indeterminate potential, or CHIP. This is a change that happens in people. It's a somatic, so an acquired genomic alteration that occurs in hematopoietic cell lines. And it doesn't indicate the presence of cancer, but it's associated with an increased risk of developing cancer. And it happens in older individuals. And this paper that we publish is the first potential population level evidence of chip-like findings in dogs. That to me is so exciting, getting to find things that happen infrequently, but because we're able to look at such large population level data sets, that's incredibly exciting. So that's kind of on the liquid biopsy side. On the veterinary side, I think that probably a lot of oncologists would agree that the fourth pillar of cancer therapy is immunotherapy. And I just think that huge strides are being made in immunotherapy, and they will continue to be. So that's completely separate from the liquid biopsy stuff. But I think that that's really going to be a great novel tool for therapy that we oncologists have in our toolbox.
Right. I think there's a lot of exciting stuff coming out, both in animals and people. I feel like we usually a lot of times hear more people, but it is exciting to hear all the new stuff coming out with animals. And yeah, it'll be exciting to keep watching. Certainly love seeing the papers you guys produce and your posters and things. So again, thank you guys for really, delving into your research and looking for that stuff. Because I do feel like sometimes people are sitting on this gold mine and they don't even realize it. So definitely excited that you guys tease through all that. And then Dr. Flory, before we wrap up, is there anyone that you would recommend to be on this podcast?
Yeah, I think that one of the things that I've been really lucky to have in my career and in my journey is great mentorship. Sometimes a nudge from a great mentor can tell you right at the right time that you have what it takes and that you should believe in yourself. And for me, I had a great mentor. I had great mentors in vet school and internship and residency, but one of my mentors in my internship was Dr. Amy LeBlanc. She's the director of comparative oncology program at the NCI now. And I think in veterinary oncology, a lot of us look to what they do in human medicine to understand how best to treat our patients. And we also understand the benefit of being able to learn things from animals that can benefit people and vice versa. And I think comparative oncology is so important for research that benefits individuals on both sides, for both animals and for people. And someone that's really paving the way and leading the charge there is Amy LeBlanc. So I think she would be a great guest.
Yeah, that's a great idea. Thank you so much. We'll certainly reach out to her. And Dr. Flory, again, thank you so much for being on this podcast. And how would you recommend people get a hold? I'll let you say that, PetDx website and things. What's the best way if they have questions about your products or even want to know more about your research and things? What's the best way to get that information?
I would say that just check out our website. It's PetDx.com. We have lots of resources there in terms of our peer-reviewed publications and posters. So lots of our science for all of you data-hungry veterinarians out there. I know us veterinarians are show me the data kind of people. So please just check that out to find out all of the data. And if you're interested in being able to perform oncocanine in your clinic, you can reach out to us at sales@petdx.com, or you can discuss with your IDEX or your Antech rep, and they will have more information because it's available through them as well.
Awesome. Well, thank you. And that's a pretty simple website. So, as far as the address, right? It's not complicated. So that's perfect. Well, again, thank you, Dr. Flory, for being on this podcast today. I know I learned a lot, and so I know the other listeners will too. So again, thank you so much.
Thanks for having me.
Well, that's it for this episode of the Veterinary Cancer Pioneers Podcast. If you enjoyed this episode and gained valuable insight, we would be so grateful if you could share our podcast with your friends and colleagues. And it would be even more wonderful if you want to give us a 5-star rating, positive review, or any kind of feedback on Apple Podcasts or wherever you listen. The Veterinary Cancer Pioneers Podcast is presented to you by ImpriMed.